Have you noticed subtle but troubling changes in an elderly loved one this past year? Most people assume death comes suddenly in old age, but the truth is far more complex. The human body often sends quiet warnings as early as months, sometimes even a full year, before life reaches its final chapter. The tragedy? Most families miss these critical signals because they seem insignificant at first. It's only later, looking back, that they realize the clues were there all along. By then, it's too late to prepare, too late to have those meaningful conversations, and too late to make those final memories count. In this video, we'll reveal 10 crucial signs that often appear in the year before an elderly person passes away. Some might be changes you've noticed, but dismissed as just aging. Others might be subtle shifts that actually signal the body's gradual transition. Recognizing these signs early gives you a precious gift, the opportunity to provide better care, cherish meaningful moments, and ensure your loved one's final chapter is filled with dignity, comfort, and peace. Stay with us until the end, because understanding these 10 signs can help you prepare both emotionally and practically for what lies ahead. When you recognize what's happening, you won't be caught off guard. You'll be able to make the most of every moment with those you love. 1. Significant weight loss. One of the earliest and most revealing warning signs is unintentional weight loss. At first, it might appear subtle. A belt needing an extra notch, clothes hanging looser, or a once hearty appetite beginning to fade. Many families dismiss these changes as merely part of growing older, but significant weight loss without trying is rarely benign. This weight loss signals that the body is no longer efficiently absorbing nutrients. Muscle mass decreases rapidly, and essential systems begin to slow down. While aging naturally leads to some muscle loss, when it happens too quickly, it indicates something deeper is occurring. The body struggles to digest food properly, and protein processing becomes inefficient, leading to muscle wasting that does more than just make movement difficult. It weakens the immune system and leaves them vulnerable to infections. Another factor driving this weight loss is a fundamental change in appetite. Many elderly individuals simply stop feeling hungry the way they once did. Their sense of taste diminishes, food loses its appeal, and they begin skipping meals or eating much smaller portions. This isn't just preference, it's a physiological shift. The body, sensing it's beginning its final transition, no longer signals hunger as strongly to the brain. Underlying medical conditions often accelerate this process. Chronic diseases like cancer, heart failure, and kidney disease can cause progressive weight loss long before other obvious symptoms emerge. Even conditions like depression or cognitive decline can lead to reduced eating, creating a cycle where the body receives inadequate nourishment. While the natural instinct is to encourage more eating by offering favorite foods or supplements, persistent weight loss despite these efforts signals that the issue goes beyond diet. The body is preparing for a profound transition. Rather than forcing large meals, focusing on comfort, easily digestible foods, and proper hydration often makes a bigger difference in maintaining quality of life. If you notice significant weight loss coupled with decreased appetite and increased weakness, pay close attention. This isn't merely about appearance. It's the body communicating a powerful message. Understanding this now can help you prepare with clarity, compassion, and the ability to make each remaining moment meaningful. 2. Extreme fatigue and weakness. Perhaps the most noticeable change is a deep, persistent fatigue unlike ordinary tiredness. This isn't simply feeling worn out after a long day. It's a profound exhaustion that makes even basic tasks feel insurmountable. Getting out of bed becomes challenging, walking across a room requires significant effort, and activities that once seemed routine such as cooking, dressing, or even maintaining a conversation suddenly feel exhausting. This isn't just aging. It's a clear sign that the body is conserving its remaining energy. As organ function begins to slow, the body starts prioritizing essential functions. The heart doesn't pump as efficiently, circulation weakens, and muscles receive less oxygen than before. This explains why many elderly individuals in their final months feel unsteady, weak, and unable to maintain their previous activity levels. Another critical factor is metabolic slowdown. The body's energy production systems begin to redirect resources. Instead of fueling movement and activity, the body shifts toward preservation mode. This is why someone in decline may sleep longer, require more frequent naps, and struggle to stay awake for extended periods. Many experience sudden energy drops, seeming fine one moment but completely drained the next. Perhaps the most heartbreaking aspect is the emotional impact. Many seniors who once took pride in their independence become frustrated or embarrassed by their inability to function as before. They may withdraw from conversations, avoid social gatherings, or abandon beloved hobbies, not from lack of interest, but from sheer lack of energy. This often creates a cycle of isolation that accelerates their decline. For families witnessing a once active loved one become exhausted and withdrawn, the situation can be confusing and painful. It's tempting to encourage them to push through it, or assume they're simply not trying hard enough. But in reality, forcing activity won't help. What matters most is understanding their limitations, allowing rest when needed, and making their remaining time as comfortable as possible. 3. Cognitive changes and withdrawal. As a person approaches life's final stage, one of the most striking changes appears in how they think, communicate, and interact with others. You might notice someone who was once sharp and engaged starting to forget things more frequently, struggling to follow conversations, or becoming disoriented in familiar surroundings. They may repeat themselves, forget names, or lose track of time, even if they never had memory issues before. These subtle cognitive changes can appear months or even a full year before death. This isn't ordinary forgetfulness. The brain, like all organs, requires steady oxygen and nutrients to function properly. As circulation weakens and oxygen supply diminishes, cognitive function begins to decline. Your loved one may become easily confused, struggle with decisions, or have difficulty recognizing people and places they've known for years. Many experience fluctuating lucidity, clear moments followed by sudden confusion, as if their mind is fading in and out. Another significant sign is emotional withdrawal. Someone nearing the end of life often loses interest in social interactions. You might notice them speaking less, engaging less often, or spending extended periods sitting quietly. It's not that they no longer care about their loved ones. Their brain simply no longer processes emotions and engagement the same way. Conversations become tiring. Loud environments feel overwhelming. And eventually, many seniors retreat into their own inner world. You may also observe mood and behavior changes. Some become irritable, anxious, or easily frustrated, while others seem unusually calm, detached, or indifferent to things that once mattered deeply. This isn't merely a personality shift. It's often the brain adjusting to the body's decline. 4. Frequent infections and slow healing. As the body begins winding down, one of the clearest physical indicators is a weakened immune system. You might notice that someone who rarely got sick before now seems to catch every illness that circulates. What used to be minor ailments now take significantly longer to recover from, and simple wounds like small cuts or bruises heal at a noticeably slower rate. These changes aren't random. They signal that the body can no longer defend and repair itself effectively. Repeated infections become particularly concerning. Pneumonia, urinary tract infections, skin infections, and even oral infections occur more frequently as immune function declines. Many families mistake these as isolated incidents, but when they happen repeatedly or take longer to resolve, it often indicates the body is losing its defensive capabilities. Even antibiotics that once worked quickly may seem less effective. Your loved one might need stronger medications, longer recovery periods, or multiple treatment rounds for infections that would have been minor before. This happens because declining circulation and organ function prevent the body from responding to treatments as effectively. Another overlooked warning sign is chronic wounds. If you notice small scratches, sores, or bruises that won't heal properly or keep reopening, it likely indicates compromised circulation. Poor blood flow means oxygen and nutrients aren't reaching the skin and tissues efficiently, dramatically slowing the healing process. Pressure sores become a serious risk, especially for those with limited mobility, and can lead to dangerous infections if not carefully managed. What's particularly concerning is that infections in the final year of life often don't present normally. Instead of a high fever, an elderly person might simply seem more tired, confused, or uninterested in eating. In fact, for many seniors, sudden cognitive changes are often the first warning sign of infection, even before other symptoms appear. For families watching a loved one endure repeated infections, the experience can be frustrating and heartbreaking. It's natural to push for aggressive treatments, hoping that one more antibiotic course or hospital stay will solve the problem. But eventually, the focus often shifts from curing to comforting, ensuring they stay hydrated, keeping skin clean and moisturized, and minimizing stress on the body frequently does more for their well-being than another medication round that might prolong suffering. If you're still with me and finding value in understanding these signs, please comment below. I encourage you to subscribe and turn on notifications to stay informed. Your engagement helps our community grow, and if you haven't subscribed yet, now's the perfect time to join us. Your support helps us continue creating content that matters. 5. Breathing and circulation changes. One of the most telling signs that the body is preparing for its final transition is a noticeable change in breathing patterns and circulation. You may observe that your loved one breathes more slowly or shallowly than before. At times, they might pause between breaths, or their breathing might become irregular, speeding up and then unexpectedly slowing down. Some people develop Cheney-Stokes respiration, a distinctive pattern where breathing alternates between deep, rapid breaths and extended pauses. These changes often begin subtly but become more pronounced and frequent over time. Another common indication is weakened circulation. You might notice that hands, feet, or even the nose and ears feel unusually cold to touch. The skin may appear pale, bluish, or mottled, particularly around the extremities. This happens because the body prioritizes blood flow to vital organs, reducing circulation to limbs. It clearly indicates the heart isn't pumping as strongly as before. Many people also experience increased shortness of breath with minimal exertion. Simply sitting up, speaking, or changing positions might leave them winded. You may notice them breathing through their mouth more frequently, or needing to pause mid-conversation to catch their breath. Activities they once performed easily, like walking across a room, may now cause breathing difficulties, suggesting declining lung function. 6. Kidney function. Decline in urinary changes. As the body continues its transition, kidney function often begins to decline significantly in the final year of life. This creates two distinct but related issues that families frequently notice: decreased urine output and problems with incontinence. With decreased output, the kidneys simply produce less urine as they start failing. You might notice your loved one using the bathroom less frequently, and when they do, their urine appears darker, more concentrated, and has a stronger odor. This happens because the kidneys can no longer effectively filter waste products from the blood. These waste products that would normally be eliminated begin accumulating in the bloodstream. Simultaneously, many elderly individuals develop incontinence issues, the inability to control when they urinate. While decreased output is about the kidneys producing less, incontinence relates to the loss of muscle control over the bladder. This distinction is important because they require different approaches to maintain comfort and dignity. What many families don't realize is that declining kidney function affects more than just urination. The buildup of toxins in the bloodstream that would normally be filtered out can lead to confusion, delirium, and other cognitive changes. This explains why someone might suddenly seem more disoriented or experience personality changes that seem unrelated to their urinary symptoms. Another concern is that dehydration often accompanies these kidney changes. As someone drinks less due to decreased thirst or difficulty swallowing, the kidneys have less fluid to work with, creating a cycle of further concentrated urine and increased toxin buildup. This creates challenges for caregivers because pushing fluids might cause discomfort from frequent urination or incontinence, but insufficient hydration accelerates decline. 7. Temperature regulation and body changes. In the final year of life, the body often loses its ability to regulate temperature effectively, a subtle but significant sign that bodily systems are beginning to falter. This isn't simply feeling occasionally too hot or cold. It's a fundamental breakdown in the body's thermostat. You might notice that your loved one alternates between feeling uncomfortably warm and then suddenly chilled, regardless of the actual room temperature. They might kick off blankets one moment and request more the next. This temperature dysregulation happens because the hypothalamus, the brain's temperature control center, becomes less efficient as circulation and neurological function decline. Alongside these temperature fluctuations, visible skin changes often appear. Many develop what medical professionals call mottling, a distinctive purplish-blue marbling pattern that typically begins on the feet, knees, and hands before potentially spreading upward. This occurs because blood vessels near the skin surface begin contracting irregularly as circulation weakens, creating this patchy discoloration. The extremities, hands, feet, ears, and nose, frequently feel cold to touch, sometimes even when the person reports feeling warm. This happens because the body instinctively redirects blood flow to protect vital organs, reducing circulation to peripheral areas. You might also notice the skin becoming thinner, more translucent, and developing a waxy appearance that makes veins more visible. 8. Myoclonic jerks and muscle changes. In the months leading up to the end of life, many elderly individuals experience sudden, unpredictable muscle movements known as myoclonic jerks. These aren't ordinary muscle twitches or tremors. They're distinctive, involuntary movements that appear without warning and can't be controlled. You might notice your loved one's arm or leg suddenly jerking or their entire body briefly jolting, almost like they've been startled. Some experience repetitive twitching in their fingers, hands, or facial muscles. What makes these movements different from normal muscle spasms is their random nature, and the fact that they often occur even during sleep or periods of rest. Despite their alarming appearance, myoclonic jerks typically aren't painful for the person experiencing them. However, they can be deeply distressing for family members to witness, often creating fear that something is seriously wrong, or that their loved one is suffering. Understanding that these movements are a natural part of the body's neurological changes can provide important reassurance. These muscle changes happen because the nervous system begins functioning differently as the body prepares for its final transition. The brain's electrical activity becomes less coordinated, sending random signals to muscle groups. This same neurological shift also explains why reflexes in the arms and legs often diminish during this period. The normal pathways that control movement become increasingly disrupted. Beyond the visible jerks, broader muscle changes occur as well. Many experience increased stiffness, particularly in the morning or after periods of inactivity. Others develop unusual postures or positions that would have been uncomfortable before but now seem to provide relief. This happens because muscle tone changes significantly as protein metabolism declines and neurological signals alter. 9. Visions and hallucinations of deceased loved ones. One of the most profound and commonly misunderstood end-of-life experiences involves visions or hallucinations, particularly of deceased loved ones. Many people in their final year report seeing or conversing with family members or friends who have already passed away, describing these encounters with remarkable clarity and conviction. Your loved one might suddenly speak to their long-deceased spouse, parent, or friend as if they were present in the room. They might describe seeing people standing at the foot of their bed or sitting nearby in a chair. Sometimes they report being visited by religious figures or describe beautiful landscapes or destinations they feel they'll soon visit. What makes these experiences particularly significant is that they rarely feel frightening to the person experiencing them. Unlike the disorienting hallucinations associated with delirium or medication side effects, these visions typically bring profound comfort, peace, and even joy. Many report feeling reassured or experiencing a sense that these visitors have come to accompany them on their final journey. The medical community has increasingly recognized that these aren't simply confusion or drug reactions. Research suggests they represent a unique category of perception that occurs as the brain processes the transition between life and death. Some studies indicate that up to 60% of people experience some form of these end-of-life visions, though many never share them for fear of being dismissed or labeled confused. 10. Emotional preparation and death anxiety. In the final year of life, many people undergo two seemingly contradictory emotional processes: preparation for death and anxiety about dying. Understanding both aspects helps families provide better support during this delicate time. Early emotional preparation often begins months before physical decline becomes obvious. You might notice your loved ones suddenly wanting to organize financial affairs, distribute personal possessions, or discuss funeral arrangements. They may spend more time reminiscing about their life, almost as if conducting an internal review of significant moments and relationships. Some express specific wishes about end-of-life care, or begin giving away treasured items to family members. These behaviors aren't morbid obsessions, but rather healthy psychological preparation. Research suggests that many people intuitively sense they're approaching death long before medical signs confirm it. This awareness triggers an innate desire to put affairs in order and create closure in important relationships. Rather than causing distress, this preparation process often brings peace and a sense of completion. Simultaneously, many experience periods of death anxiety, a specific form of fear focused on the dying process or what might happen after death. Unlike preparation, which feels purposeful and organized, anxiety manifests as restlessness, worry, and physical symptoms like heart palpitations, sweating, stomach distress, or insomnia. What's important to understand is that someone can alternate between these states, feeling calm acceptance one day and overwhelming fear the next. This fluctuation isn't a sign of confusion, but rather reflects the complex emotional journey of approaching life's end. As we reach the end of our journey together, take a moment to reflect on the 10 signs we've discussed: significant weight loss, extreme fatigue, cognitive changes, frequent infections, breathing alterations, kidney function decline, temperature dysregulation, muscle changes, end-of-life visions, and emotional preparation and anxiety. These signs often appear in the year leading up to an elderly person's passing, though they rarely manifest all at once or in a predictable sequence. For many families, recognizing these changes brings mixed emotions. There's natural resistance, a desire to fight against them, to encourage more eating, more activity, more engagement with the world. But sometimes the most compassionate response isn't fighting the inevitable, but rather listening to what the body and mind are communicating. Understanding these signs isn't about surrendering hope. It's about redirecting our focus from extending life at all costs to enhancing the quality of remaining time. It allows us to make important decisions proactively, ensure comfort rather than unnecessary intervention, and create space for meaningful moments that might otherwise be lost in medical crises. This knowledge empowers us to answer the deeper questions. What truly matters in life's final chapter? Is it more important to fight for additional weeks, or to ensure that the time remaining is filled with dignity, comfort, and love? For most families who have walked this path, the answer becomes clear. Quality of connection outweighs quantity of days. Recognizing these signs early creates the precious opportunity to say what needs saying, to resolve what needs resolving, and to simply be present without the pressure of unfinished business. It allows for gathering stories, sharing memories, and creating lasting legacies that survive beyond physical presence. If you're noticing these signs in someone you love, take a deep breath and remember you're not alone on this journey. Countless families have walked this path before you. While it's never easy, understanding what lies ahead can help you find strength, patience, and ultimately peace in the natural transition we all eventually face. Thank you for joining us today. I'd love to hear your thoughts. Please leave a comment below sharing one insight you gained and how you might apply it in your life. Your experiences not only help others in our community, but also remind us all that in sharing our most profound human experiences, we find connection, wisdom, and hope. If you found this video helpful, please like, subscribe, and share with someone who might benefit from this information. Your support allows us to continue creating content that matters. Until next time, remember that knowledge, compassion, and presence are the greatest gifts we can offer those we love.